I had been for the last 10 years or so running the national evaluation system in South Africa and working with partners in Africa around their evaluation systems. And then when I left DPME in 2018, reflecting on what would be interesting work to take forward, thought about this, about how to try and make sure that we really learned the experience from Africa about how to make sure that use really does happen. And having worked with the 5 other countries that are part of the Twindembele initiative, thought that this would be a good place to start and approached the Hewlett Foundation to see if they would fund some research.
Clear AA is one of 6 centres. We are a network of institutions that are committed to building the ability of countries to monitor their programs and to evaluate the performance of any kind of work that they do that seeks to have social outcomes. So we in English-speaking Africa, which is the area we work in, do system strengthening. We do a lot of capacity building, which is a fancy word for training and building people's ability to do their jobs. We also do a lot of work with research and learning processes, and we work with parliaments to improve their ability to use evidence. We work across English-speaking Africa, but there are centres that work in French-speaking Africa. Well, you know, when a country or an organisation or a sector has to make a decision about how to move forward, it's really important to know what has been achieved and to be able to very clearly decide. And for us at Clear, that is really the core of our business, is helping people to gather evidence that helps them make good decisions. So the book that Ian has been working on with Mina is going to be a very helpful addition to our toolkit.
We are not academic researchers. We're activists in practice in terms of what are we learning from the ground and how are we reflecting on it and how is that helping us understand where the gaps between theory and practice are.
The book is called Using Evidence in Policy and Practice, Lessons from Africa. And Mina Pabari and myself are the 2 co-editors of the book. But we have 39 co-authors in the book.
The book covers 8 case studies. There are 8 case studies from 6 different countries. It cuts across a variety of different types of sectors, from the environmental sector to sanitation, agriculture. We even have a case study on tobacco and the tax of tobacco. The case studies also look at a number of different types of evidence and evidence sources, ranging from rapid response to formal evaluations and even including citizen engagement. So there's a lot of richness in the diversity of the case studies.
So in order to understand these case studies, we needed to develop an analytical framework. And we developed a sort of theory of change analytical framework for how evidence use happens, drawing from work that had been done on the Science About Using Science initiative, which was a systematic review of different studies that had been done on how different interventions contributed to evidence use. This framework basically starts by drawing from the context. And there we've drawn from a Context Matters framework developed by people in South America. So you need to understand the context, and you need to interpret what's possible in relation to the context, and then look at what mechanisms are possible to encourage use and what outcomes result.
I think the role of the analytical framework is really to make sense of the richness that we have in all the different case studies. So you can imagine you've got experience around evidence-informed policymaking from Ghana, from Kenya, from Uganda, from the whole continent. And how do you make sense of this knowledge in a structured manner? It's trying to give a frame to make a sense of the overall evidence base. And if we don't have something like this, we might end up in a situation where we have lots of individual learnings, but we can't see the overall picture. In the African evidence ecosystem, we often see that we work in silos, like national silos, silos according to methodologies, silos according to sectors such as health or social development. And that's something that the framework actively is trying to bridge. So it's trying to be a tool that allows us to learn from each other, to identify synergies across these different silos, that ideally we can look across the entire evidence ecosystem on the continent. At the highest level, we see a sequential list of activities that starts on the left from demand for evidence and ends on the far right with development impact. And this sequential list is surrounded by two big blue boxes that try to capture the context in which these activities take place. It assumes that the demand for evidence should be our starting point. If we talk about evidence use and the user herself is not driving this, we feel we might be missing the boat a little bit. That's why deliberately the framework does not start from a supply perspective, but from a demand perspective. The next activity we believe is needed is the production of evidence. However, very quickly then we move away from the actual evidence, the supply of it, and we want to understand how does this evidence being used. And it is our belief that there's a passive uptake of evidence is often unrealistic, that we need an active intervention, an active strategy or an action or some form of something that intervenes in the current context and facilitates the use of evidence. And this is what we call an evidence use intervention. However, this kind of massive plethora of evidence use intervention, in a way, they work, in our understanding, through a small number of change mechanisms. So as much as there's many interventions, we believe there's particular aspects of these that drive change. And this is what you see in the box in the middle as the evidence change mechanisms. And we would now want to move towards the evidence use, the outcome itself. And this is what you see in the blue boxes as individual organizational systems change. And here we borrow from Susan Michie as a behavior change framework, who understands behavior change to be broken down into the motivation to change, the capability to change, the opportunity to change. And in our evidence world, this would translate into the opportunity to use evidence, the capability to use evidence, or the motivation to use evidence. And so we assume that these change mechanisms, they affect decision makers' intermediate outcomes around these three dimensions, the capability, opportunity, motivation dimensions. And if we then have that as an achievement, then we can talk and look at the actual evidence use, which you see at the light green box on the second box from the right. The very last step on our framework is then, how does this evidence use link to the actual development impact? So if we have policies that are based on evidence, do these actually translate into better developmental outcome for communities, for households, for individuals, etc. And this you see on the far right, broken down as policy performance and impact and wider systems change.
But actually, before even that generation happens, some interventions happen to try and encourage the use of that evidence. So, for example, trying to make sure that the process is owned by stakeholders, trying to make sure that it goes through the right formal channels so it's likely to be used, making sure there's the right leadership in it, etc. So there's what we're calling here use interventions, interventions to promote use that happen before the evidence generation, then during the evidence generation, and then once the evidence generation is finished.
Between 2014 and 2016, we did a diagnostic review looking at how the government is responding to violence against women and children. We established evaluation steering committees, and that helps us to bring multiple stakeholders in the process of designing and implementing the evaluation. We also have the technical working group, which means that you're bringing also other departments in the framing of questions and not kind of bringing them later on. Also that all evaluations go to cabinet, which means you have multiple ministers and heads of departments hearing about the results of the evaluation. You also have management response, which means that when we have a report, management must actually take account of that report and commit to responding to the recommendations. And then lastly, we have an improvement plan.
Those use interventions will result in triggering something in people that are part of the process. And the things that get triggered could be around awareness, they could be around that they now agree, that they trust the evidence generators. And based on that, this causes a change in them and helps to build their capability or their motivation to use evidence and to create opportunities where evidence can happen. From that capability, motivation and opportunity, which happens at an individual level, but also at an organizational level, use, we hope, happens. One of the challenges of evidence use is that to get from a recommendation in an evaluation, for example, it being taken up in a program, to that having an impact on the ground, to people on the ground, may take many years. So in the cases that we looked at, there are a couple of them where we could see some direct development impact. I mean, and one example, for example, was Benin, where because of the policy changes that happened, to which the evaluation contributed, there were changes in the cotton sector, and the cotton sector actually has become very successful in Benin. It's one of the major producers in Africa. The next level is actually changes in policy and practice. Many of the cases actually showed changes in policy or legislation. In Benin, they developed a new agricultural policy, and that's actually leading to legislation now. There's also then changes in procedures and processes, and that's very common because many of the recommendations are, set up an M&E system, improve your criteria for this, et cetera, and there were many examples of where that happened. On changes in budget, that's actually an area where many did not show, and I think this is probably quite typical of that. In much of the evidence generation, the cost side of it and the implications for budget is actually poorly considered and expressed. So we only saw a couple of the cases actually where you could directly see changes in budget.
You can still see the diagnostic review being referenced in terms of what it recommended must happen. The increase of budgets by National Treasury for the Department of Social Development, which was a combination of the recommendations from the diagnostic review, the lobbying that was still happening from civil society organizations and some of the members of the Violence Prevention Forum, having a treasury official who was now getting to understand what violence prevention is about and how to help the sector basically to address some of the challenges they were facing.
So one of the important lessons that emerge from the case studies is that the evidence journey takes place within a context, and there are multiple factors that influence how the journey plays out and whether or not the evidence is actually used. How important is the policy issue that's being explored? Policymakers are juggling a variety of different priorities. The higher the priority this particular policy issue is, the more likely the evidence is going to get attention. So an example of where the policy issue is significant is in Ghana. What you had there is in 2008, all of the heads of state across Africa had signed on to a declaration really committing themselves to improving the sanitation sector. And this was an important driver. Another example of where the policy issue is significant was in terms of the level of financial investment that has been made in a particular policy issue. Other contextual influences that we identified in the cases is catalysts of change, for example. We had an event or a crisis which was taking place in the country. Kenya is a very good example of that, where you had a poaching crisis. And so there was pressure for the country to do something about the policy at the time, and therefore there was a lot of interest in the evidence journey and the fact that the evidence journey was used to bring about a positive change. The broader factors within the broader political and social environment are also important. Timing. The closer an evidence journey is, for example, to an election, the less likely you're going to have policymakers interested in the evidence itself, as their attention is going to be diverted elsewhere. And the institutional environment, so factors within the institutional environment featured very strongly across all of the case studies. Structures and processes, whether or not you have a national evaluation system in place. Are there evidence champions, particularly if the evidence champions are leaders? So in the case of the tobacco case study, for example, the champion here was the director of CRES. In this case, the individual was very well connected, had some very strong relationships across the regions, and was able to draw on these relationships to enable the evidence journey.
Realization in these cases is how important what we're calling process facilitation and knowledge brokering is in all these cases. Where evidence is having an impact, the whole process is actively curated. There's an active process of engaging on the demand side. There's an active process of engaging with the supply, the delivery of the evidence. It's an active process of working out how it's communicated, what time it's communicated, different mechanisms for different audiences, following up when there are hiccups in the process. It doesn't happen by accident. And so this whole process of facilitation and knowledge brokering is very important. But actually, one of the very interesting things I think that's come out from this is how important conceptual use was. Conceptual use is where the evaluation actually led to better understanding, and that was in itself powerful. So, for example, in the Benin agriculture evaluation, actually the recommendations from the evaluation were not used, but the insight generated by the evaluation was very important in informing later policy development. There are also process uses where it's helped people to understand how their program's working, what they can adjust during the evaluation process, not after the evaluation, but actually during the evaluation process. So what we're hoping to move towards is to where this whole process becomes much more purposive. From the very beginning of the process, before you even select which evaluations or which research you're going to do, you're saying, how do we make sure that whatever we do here is desired, will be acted on, and you maximize the likelihood that that will happen. We're going to be working with some related projects to try and find opportunities to work with policymakers, certainly in the 5 or 6 countries that we've been working with on the book, but also potentially in other countries to see where there's an interest in trying to apply this. Hopefully what we will see as a result of this, that there will be some governments that are better able to use evidence effectively, and as a result can make better quality decisions, can improve their policies and their practice, and have better impacts on the lives of citizens.
Some of the big questions that we need to be answering as a species relate to climate change, to inequality, to poverty, to unemployment, to gender issues. And those are very political, and they require that people understand what the implications of long-term decisions are for them. We think that policy making that is robust and strong and thoughtful requires that people who often get left out of that decision making get included. And that's something you have to really plan for. You've got to have strategies for drawing in people who often get left behind. We have to get better at gathering information, at using that information to make decisions. And that means that institutions like CLEAR are very, very important and have a big role to play in the future. You know the African proverb that if you want to go fast, go alone. And if you want to go far, go together. It's not like anybody can solve these problems on their own. And that business of developing partnerships, working together to solve these problems is the kind of thing that Ian's done in the book. He and Mina have been very thoughtful and very mindful about drawing in a whole broad range of contributors. And I think that's the kind of solutions we need to be looking for in the era of complexity. So the book is a really important contribution to the work that we do. And it's important because it's based in real life experiences. So this isn't some theoretical exercise. It's a case of people really talking about things that have happened and locating it in African realities. And if there's one thing we know about Africa, it's a very diverse place. There's a very wide range of experiences, very different contexts. And so what Ian's book does for us is it's an amazing opportunity to start exciting conversations, and it starts talking about the real challenges. It highlights what some of the solutions are, like knowledge brokering and the importance that relationships have, the role that soft skills, your emotional intelligence play in this stuff. And so we intend using Ian's book as an input to all of our work, and we're excited about the role that it's going to play in our own program.